So for the pain, it started 6 years ago, and it's progressive from the neck to the upper back, to the shoulder, to the lower back, and then down to the toes. And how did you treat the pain at that time?
Well, at the beginning, as I told you, like I got a cold for a month that long. So
you saw the family doctor?
I saw the family doctors and advice, and they got some painkiller type of medicine to help the pain.
Yes.
But when the dosage increased, my stomach can't
tolerate
it. So it's turned into other problems like infection to my ears or even nose. Because my bodies may not be able to tolerate that much medicine.
I see.
And then the pain actually get worse at that time.
I see.
So the doctor advised me to go to orthopedic surgeons and see, and then they X-ray my neck as well as MRI,
yes,
my neck.
Yeah.
And they saw that maybe it's because of my car accident. So
that happened 10 years ago.
Yeah, which happened 10 years ago, and which affected my neck
at that time.
That time, and they suggest if I want to heal the pain completely, they suggest a surgery, which I think might not be the way that I want to go at that time. So I see the physio and chiropractors. Chiropractors, and they try to align my neck.
Yes, the neck and back.
Because at that time I will focus on my neck because everything is start from my neck.
Yes.
And they try to align my neck.
Yeah. But
I found that it doesn't work because my muscle is too hard.
Too tense,
and they really not really able to move very.
Couldn't do too much.
And then they saw my shoulder have problem as well, so they try to fix my shoulder. But when they try to fix my shoulder, it can move my neck a bit. But when I did the treatment, and then the positions is turned back automatically to because maybe the muscle is too tight, so it really unable to fix it to the right positions. So when you did the treatment, like few seconds or few minutes later, it's turned it back to the original position.
I see. So and then what other medical practitioners have you seen?
Well, I think in Hong Kong very common if you can't get a Western sort of doctor to solve the problems, you go to the Chinese doctor.
Yes.
Well, same as others. I went to the Chinese doctor, medicine, and then they suggest a bone setting. I did the bone setting. They did it from my lower back even to my shoulder and my neck together. They can move it, but I think the muscle is still too tight or too tense. It doesn't last long. And the bone setting, doctor said you can't, constantly come like 2 days later and fix it again and again. It will hurt your tendons or any other things as well.
So how frequent you have to see doctors at that time, or see the bone sectors?
Longest, I think.
I mean, how many
times? Like 4 times a week.
4 times a week.
That I need to go from the beginning, like a week, 1 time a week to at the end, like 4 times a week. For this type of treatment, like it's took me 3 years. Just 3 times a week and 4 times a week to visit the doctor.
So there's for the whole 3 years you have to visit doctors every 3 to 4 times a week.
Yes.
For the 3 years time. Okay.
Except their holiday that I don't need to see them.
Okay. So and then I know that you also tried acupuncture before, right?
Yes.
And then
because bone setting, they said like they try acupuncture firstly. It's bone setting that doctor try acupuncture. I feel that it works. So the doctor suggests me maybe acupuncture will help me eventually. So that's why I go to see an acupuncture doctor. And I feel like it helped. The treatment, can stay for longer. That my pain go away for longer, or it's not go away. It's just less painful.
So
longer
it's
time.
partially relieved.
Yeah, partially relief without taking any medicine. So that's why I go like 4 times a week to
for
see
acupuncture.
because they have a treatment that you need to go quite frequently. And when they the needles went into, I don't know, muscles or the acupoints positions, I can feel that the what muscle is releasing. So so it's less painful.